Okay. I'm starting with a brief introduction about the novel lipid enriched method in animal science. We can find three main reasons: the lipid profile of meat and meat products, the current consumer habit, and the existence of bioactive compounds, specifically omega-3 fatty acid, EPA, and DHA. The lipid profile of meat and meat product is high variable, but in general, this food contains high percent of saturated fatty acid and low content of polyunsaturated fatty acid. However, meat and meat products have high biological value proteins and important vitamins and minerals. It is demonstrated the beneficial health effect of the omega-3 fatty acid. In fact, it has been determined adequate intake for the sum of EPA and DHA, which is around 250 milligrams per person a day. Main sources of these two fatty acids are fins and marine foods. However, with the current consumer habit, the intake of the omega-3 sources is insufficient to achieve this adequate intake. On the contrary, the consumption of ready-to-cook and ready-to-eat food, especially from meat products, is increasing nowadays. Considering this aspect, it can be a good idea the enrichment of this well-accepted food with the sources of omega-3 fatty acid. There is, in relation to this, there is a European regulation that establishes the quantity of EPA and DHA which food should contain to be labeled as sources of omega-3 fatty acid or high in omega-3 fatty acids. These quantities are at least 40 milligrams per 100 sample or 80 milligrams per 100 sample, respectively. In the scientific literature, there are different strategies that have been tried to increase the omega-3 content in food. These strategies are based on adding the fish oil to the animal feeding or to the food by direct addition or addition as an emulsion. However, in most of the cases, even when antioxidants are added, we found problems with the oxidation of the fatty acid due to the polyunsaturated fatty acid are high susceptible to be oxidized. In order to solve this problem, the microencapsulation can be a good solution since the goal of the microencapsulation is cover with a wall the drops of oil in order to protect the polyunsaturated fatty acid from the external factor that enhance the oxidation. In meat and meat products, there are some studies that have evaluated the addition of fish oil microcapsule to different meat products. In this study have evaluated the percentage of EPA and DHA the oxidation stability and the acceptability of the enriched meat product. However, no study on the quantification of EPA and DHA, nor the bioavailability or bioaccessibility of these two fatty acids have been found. These aspects are close related to the coating wall of the material for the microencapsulation, since these materials are important, are critical to protect the bioactive compounds in the food and also to achieve their release at the target site. Considering this aspect, this study aims to evaluate the enrichment and in vitro gastrointestinal release of the omega-3 fatty acid in meat derivatives as affected by the addition of different fish oil microcapsules. Moreover, the influence of storing and culinary cooking of the meat product was also evaluated. For that, we firstly prepare the fish oil microcapsule following the procedure previously optimized in our lab. We mix the fish oil with the emulsifier with lecithin to have a primary emulsion which is homogenized at high pressure. Then water is added to have the secondary emulsion, and finally the whole material are added. We use maltodextrin or maltodextrin plus chitosan. In this way, we have the final emulsion, which is spray dry to finally obtain the power of microcapsule. This power of microcapsule is added to the food as an ingredient. In this slide, we can see the two types of microcapsule. The monolayer, which is made of lecithin and maltodextrin with the fish oil, and the multilayer with lecithin, maltodextrin, and chitosan. Regarding the meat derivatives, we elaborate in this study cooked sausages and dry cured sausages. They were processed in a meat industry. From each product, we prepare 3 batches. The control one without addition and those enriched with monolayer or multilayer microcapsule. Besides the effect of the enrichment with the fish oil microcapsule, in this study we also evaluate the storage during 4 months and the culinary aging in the case of the cooked sausages. In the microcapsule, we determined the lipid content, the microencapsulation efficiency, which is the encapsulated oil related to the total oil of the microcapsule. At this point, it's important to indicate that not all the fish oil is encapsulated. It's inside of the microcapsule. Part of the oil is in the surface, okay? And in the microcapsule, we also quantify the EPA and DHA. In the meat product, we also determine the lipid content, the quantity of EPA and DHA, and in this food, we also carry out an in vitro digestion. For the in vitro digestion, we try to imitate, to reproduce the three phases of the gastrointestinal digestion: the oral phase, the gastric phase, and the intestinal phase, and quantify the lipid and the fatty acid released at the end of each of these phases. Moving on to the results and discussion, we started with the results on the microcapsule. In both types of microcapsule, monolayer and multilayer, the lipid content was similar, around 9 to 11%, including the external and encapsulated oil. The microencapsulation efficiency was higher in the monolayer microcapsule in comparison to the multilayer one. I mean, the oil encapsulated was higher in the monolayer microcapsule, while the quantity of EPA and DHA was similar in both types of microcapsule. Regarding the meat derivatives, the lipid content was for the cooked sausages around 17.5% and 26% for the dry cured sausages. The addition of a microcapsule didn't influence in the percentage of lipid of the meat product, and we didn't find a significant effect of the storage or culinary heating. This figure shows the quantity of EPA plus DHA per 100 grams of sample in the three batches of cooked and dry cured sausages before and after being stored. We found a significant enrichment effect, finding higher quantity of EPA and DHA in the enriched batches of two products in comparison to the control ones. This means that the addition of the monolayer and multilayer microcapsule achieved the enrichment in omega-3 fatty acid. Moreover, we can see that the quantity of all the batches was higher than 40 milligrams of EPA plus DHA per 100 grams of sample, which allows us to label this food as sources of omega-3 fatty acid according to the European law. We can also see that there are not differences in the quantity of EPA and DHA between the batches before and after being stored. In addition, the type of product seems to be significant in this quantity. We can see a bit higher quantity of EPA plus DHA in the dry cured sausage, which can be related to the desiccation process in this kind of food, which concentrate all the components. Regarding the culinary heating effect in the cooked sausages, no significant differences were found between the cooked sausages before and after being heated. This figure shows the images from scanning electron microscopy in the three batches, control and enriched batches in the two studied products in this study. As you can see, we can observe the microcapsules in the enriched product, but not in the control ones, which again shows or indicate the enrichment in omega-3 fatty acid with the monolayer and multilayer microcapsules. Regarding the in vitro digestion analysis in the meat derivatives, this figure shows the percentage of fat release at the end of oral, gastric, and intestinal phase in the three batches of cooked and dry cured sausage. We didn't find a significant enrichment effect. I mean, the percentage of fat release was similar in control and enriched batches, which indicates that the addition of the microcapsule didn't affect the gastrointestinal digestion of the product, which is good. In addition, we can also observe that some differences in the percentage of fat release between cooked and dry cured sausage. As you can see, the percentage of fat released at the end of the intestinal phase was higher in the cooked meat product in comparison to the dry cured ones, which can be related to the different matrix between the two meat products. These graphs show the quantity of the percentage of EPA and DHA released at the end of the intestinal phase. We found the significant effect of the enrichment, finding higher quantity of EPA and DHA release when multilayer microcapsules are added. In addition, the percentage of EPA and DHA release was also different between products, with a higher percentage release in the case of the cooked sausages. Then we can find the highest percentage of EPA and DHA in the cooked sausage enriched with multilayer microcapsules. Finally, these figures show the quantity of EPA and DHA released at the end of each phase of the gastrointestinal analysis in the two products enriched with monolayer and multilayer microcapsules. Again, we can see the highest release of EPA and DHA when the products are added with multilayer microcapsules. It's also interesting to observe that the highest release is found or take place at the end of the intestinal phase, which warranty a high bioaccessibility of the EPA and DHA. All these results have been published in different publications. And finally, I'm going to read the main conclusions. The addition of the fish oil microcapsules of this study to cook and dry cure meat products achieved their enrichment in EPA and DHA, not being influenced by the storage or culinary cooking, but susceptible to be labeled as sources of omega-3 fatty acids. The release of fat from the meat product is not affected by the addition of fish oil microcapsule, but it influences on the bioaccessibility of EPA and DHA. Moreover, the type of meat product seems to be a significant effect on their release. Thus, the addition of the multi-layer fish oil microcapsule to cook sausage should be more appropriate than the monolayer microcapsule and dry cure sausage. Therefore, it could be pointed out the importance of analyzing not only the quantity of EPA and DHA in the enriched food, but also the viability of this bioactive compound in most of the possible products. This could be used to develop functional food and provide healthier lipid profile and promote health and welfare. I would like to acknowledge the funding for this project and my mates Juan Carlos Solomando Garcia and Proof Teresa Antequera. And for all of you, thanks a lot for your attention. And I'm showing also a picture from my town, Cáceres, in Spain.